If you were out and about at Pride events this summer, you will have a chance to help shape LGBTQIA+ two-spirited health policy. Community-based Research Centre, a nonprofit here in Vancouver, has launched a national survey called Our Bodies, Our Health. It says there is a dangerous gap in government health data from the LGBTQ+ community. Nathan Lachowsky is the CBRC's research director. He joins us now. Nathan, thanks for being here. Perhaps the big question first off is, what information do you feel the government is missing that might hurt people in the community?
Yeah, we lack a lot of essential data on the sexual and reproductive health of 2SLGBTQ people, which means that we can't plan appropriate health services or education for the community. And the few data sets that do exist in public health or government rarely collect information about being 2SLGBTQ. So it's important that we collect these data this summer to fill that gap.
Are you able to share some examples of stories that perhaps illustrate the need for more data on the ground experience?
Yeah, absolutely. I mean, myself as a young gay man, I remember wondering where to go to get reliable, accurate information on sexual health. I think many of us can probably connect with that. And nowadays, there's so much more misinformation on the internet, and comprehensive sex education is not taught in every school. And then I think about some of my friends and colleagues that I work with, and there's so many instances of being denied appropriate healthcare, especially in this realm of sexual and reproductive health. So a trans person not being able to, or not being asked about fertility preservation when they're undergoing gender-affirming care, or for queer women being denied contraception or HPV screening when they ask for it from their healthcare provider.
Why do you think there is such a gap in government data here?
I mean, I think we can all acknowledge a lot has changed with respect to sexuality and 2SLGBTQ communities over the past decades. And really, this is a bit of a matter of our data systems needing to catch up. We're starting to see the federal government collect more information about our communities. But at the same time, we also know that there is still overt discrimination against 2SLGBTQ people. And some people in our communities don't trust the government with that information about themselves. And so this is a little bit of the importance of why we need to lead this data collection effort this summer.
How open do you think people in the community will be to offering this information?
We've had an amazing response so far. We started our data collection this summer in Winnipeg earlier this month, and we're continuing to visit over 2,000 communities across Canada. And we've found that people are really interested in the opportunity to share their stories, to be validated in their experiences, and to really feel like their data is going to be put to good use in terms of advocating for better health services and systems.
For someone watching this, hearing about this, and they want to participate, how can they do that?
Well, hopefully we'll be at a Pride Festival near you at some point this summer. But if you're not at a Pride Festival that we're at, you can visit CBRC.net or search the internet for Our Bodies, Our Health, which is the name of our study, to find out where we're going and also to be able to participate online from anywhere in Canada.
All right. Nathan Lachowsky, the lead researcher with the Community-Based Research Centre, thank you for your time. We appreciate it.
Thanks for having me, Dan.